Erdafitinib is another targeted therapy that was recently approved by the FDA for the treatment of FGFR altered urothelial cancer. Like other targeted strategies, we see evidence of activity with response and potential survival advantage. However, all of these treatments do come at the risk of toxicity, and toxicity management is key in order to continue patients on these potentially beneficial therapies for a long period of time. We looked at erdafitinib and tried to gain an understanding of when these toxicities occur so we could help educate people in the community practices and help them understand when to monitor for and when to watch for these therapies. For instance, hyperphosphatemia occurred in a very high percent of patients. However, we actually increased the dose of erdafitinib to achieve a target phosphorus level, as we thought this was a surrogate for inhibition of the FGF pathway. And by doing so, we hope to enhance the response rate for our patients. Other toxicities, such as stomatitis and mucositis, tend to occur. And when they do occur, I think it is better to start holding the drug for a shorter interval if they have a grade 2 toxicity, rather than waiting until the toxicity is grade 3. There's other novel toxicities, such as central serous retinopathy, which has been reported with other inhibitors of the MAP kinase pathway. And when we looked at the data, we saw the majority of retinopathy events, if they occurred within the first 3 months of starting therapy, and very few occurred following 6 months of treatment. So understanding the toxicity, when it occurs, and how it can be managed can be very helpful in keeping patients on therapeutic strategies for a longer period of time, aiding in the control of their incurable malignancy. And by managing toxicity, well, that's the bread and butter of the medical oncologist. And we all want our patients to live as long as possible with the best quality of life that we hope we can achieve working with them.